please tell me or explain to us what is Body to Brain?
Absolutely. So Body to Brain is a neurodevelopment learning program. It works on reflexes that may hinder a child's learning. So reflex is not an early thing. It hasn't just come about. It's been around since the 1920s, where they found relationship between awkward movements and retained reflexes. So to explain reflexes a little bit is reflexes are movements that are automatic in the womb with a baby and when they're first born. So they're learning to crawl, they're grasping, a rooting reflex where they turn their mouth to feed, a Moro reflex where they used to pat a baby on the bottom to get them to take their first breath. That's a Moro. So there's all sorts of different reflexes that automatically happen in a baby from younger. So the Body to Brain course then comes in, goes back to basics and starts really early and uses those reflexive movements to integrate those back into a child's system again, so that a child can find it easier to learn.
Can you explain what will be the benefits that our students will see?
Okay, so a child who has retained reflexes, their body will automatically react. So they'll be in fight or flight. They can be chewing on things. They can be misstepping, avoiding sports. They might reverse letters or miss words when they're reading. They can get very tired, so slumping at their desk. So all of those things can happen when the reflexes aren't integrated. The body is so busy at trying to keep the reflexes going that it can't concentrate 100% on learning. So we want our children to be able to learn easily, so it just comes fluid. It's not an effort to be able to learn, and that helps a child settle in class better. So what we're hoping to see is maybe a calmer disposition in class where they're actually wanting to learn. When they're writing, even holding a pen is easier. You're not grabbing at the pen and squeezing it. Reading will be easier. Movements will be easier. Children who shy away from sports might be more tempted to have a go because their bodies work better and more fluent. So we're hoping to see an increase in balance, coordination, an increase in ocular motor, so how the eyes work. We're hoping to see more concentration and just for the children to actually be happier in a classroom.
Can you explain some of the logistics? How often do we do Body to Brain and for how long?
So the premise behind Body to Brain is it's taken 9 months for a baby in the womb. So we're going to at least do the exercises for 9 to 12 months. The exercises consist of 1 to 4 exercises a day at a maximum of 10 to 15 minutes for the total. So they're very simple ones. We do that every single day of the week, and then they get a break over weekends. So each exercise is very simple. It works on a reflective movement of the baby. So one of them is called a windmill, and that's vestibular. Our children's vestibular has to be sorted before they can learn to sit in a chair. So if we can do the vestibular, that will help with any children who have car sickness, any children who have balance coordination issues, any children who can't tell time on a clock. So any of those things will come in. So the vestibular exercise of the windmill stays all year. And then each 6 to 8 weeks, I come in and we assess again. We don't move on until the person who's had the most issues has caught up. So we never leave anyone behind. We come in and we change the exercise, take 2 out and add another 2. And each time we develop the movements, but it's all a progression of development. So all the movements are in order so that we can progress through development.
anything that our parents or families can be doing at home to assist with body to brain?
Okay, so body to brain, because it's done every day, we don't ask the parents to do anything. They need those 2 days off. There shouldn't be any side effects except for perhaps sore shoulders, because the windmill is the arms out and turning, and it's quite hard on your arms, so the arms might be a bit sore. One of them on the floor is rolled over, and we're using our core strength. So sometimes you can have sore muscles in the core strength, as in the core as well. Be kind to them. They're doing lots of rewiring. They're rewiring their brains. They're getting ready for really nice, strong neural pathways to be able to learn effectively. So, but if there's any concerns, if anybody's not sure, if they think their child's off and they'd like some more help or some more advice, I'm happy to speak to you, but also please come to the school and speak to the teachers. All the teachers have been trained. They're very competent on all this information, and we just want to do the best thing for your children.